Thank you so much, Rochelle. Um, I am so excited to be presenting our speaker for today. So this is, if you're joining us, this is a HIV, AI for HIV speaker series that is hosted by the CAPS Developmental Core and supported by the UCSF CFAR Boost Award. So thank you very much, UCSF CFAR. And the purpose of the speaker series is to talk about applications of AI for HIV prevention and treatment. Our speaker today is Dr. Scott Comulada, who is a professor in residence in the UCLA David Geffen School of Medicine and the UCLA Fielding School of Public Health. He directs the Semel Institute Center for Community Health and the application of AI in HIV research scientific working group within the UCLA Charles R. Drew University Center for AIDS Research. His NIH-funded research includes the design and testing of AI-enabled digital health tools for populations facing elevated health risks. He plays an active role in shaping AI integration across academic medicine and public health at UCLA and serves on institutional committees developing AI competencies for medical and public health education. And he teaches undergraduate and graduate courses that prepare students to use AI responsibly and ethically in public health research and practice. This presentation that's titled AI Chatbots for HIV Prevention and Care, Types, Design, Equity, and Ethics will provide an overview of AI chatbots for HIV prevention and care using case studies to illustrate different chatbot types. And we will also talk about critical ethical and equity issues, as well as strategies for responsible implementation. So with that, I will turn the mic over to you, Dr. Comulada. Thank you so much for joining us.
Well, thanks so much, Dr. Saberi. And, I just want to say HIV research is near and dear to my heart. I've been involved in it for 20 plus years. And, I've gotten into technology in the past few years. And I'm from the Bay Area originally. So I feel like you're all kindred spirits too. I grew up in the East Bay, but I'd always love to cross the bridge and go over to San Francisco as well. And so it's a great campus. So it's just wonderful to be here with you this morning and talk about this. So I'll dive right in. I won't linger on this slide too long, as it was a wonderful introduction. So I'll just dive right into it here. Let's see, there we go. So just to give you an outline, I'm going to really get started by defining chatbots in terms of a few case studies that are HIV related. And then I'm going to talk more about the design issues for chatbots and a hugely important topic. I'm going to end by talking about equity and ethical issues around chatbots, as there are many. So I'm going to define chatbots in terms of these three case studies and talk about three different types of chatbots. And really, this got my feet wet in this whole type of work with chatbots. I started off involved in designing menu-based chatbots. And as the name implies, it's simply this notion that when a user interacts with the bot, whether it's on their phone or on a website, they select from menu options. And it's pretty easy to program because you select a menu option and the bot gives you something else and it takes you down this tree. So this is an example, a screenshot of an SMS-based bot that the purpose that was set up to assist with the teleprep program, where previously users would just call a telephone number to find out if they were eligible for PrEP, to find out information on PrEP, ask general questions on PrEP. And so the idea, we worked with the Louisiana Health Department on this one, and they wanted to see, could we come up with a chatbot where clients could interact with it after hours? So there was a 5-digit code the person could punch in to pull up the bot on their phone. It worked through SMS. And as the screenshot shows, they simply selected menu options. And it actually worked reasonably well. There's many times where selecting menu options can get you where you need to go. Being more complex is not always better. So in some cases, the menu options work pretty well. But of course, a lot of times we want the bot to be a little bit more conversational. And so as another type of bot, let's see, is this a question here? I'll try to get, oh, okay, that's not. A lot of times we want to have more conversation with the bot. And so this is the next kind of bot I'm going to talk about, and that's what we refer to as a rule-based chatbot. And it's very, very similar to a menu-based bot in the sense that the bot is really looking for keywords in the conversation to know where to direct you next. So when you program these things, you still have a basic conversation flow that you set up, but now instead of a user entering, say, A, B, or C, 1, 2, or 3, the bot uses NLP or natural language programming understanding algorithms to figure out what are the key words in what the user is getting at, or we refer to this as intent. What do they really want? And based on that, it will direct you to the next flow in the conversation. And so in this particular study, which I'm referencing, this was one now shifting gears from teleprep and HIV prevention. This one is for patients with substance use disorder and they're in treatment. This was a partnership with between UCLA, Harvard, Massachusetts General Hospital, and a private company, Demagi, that developed the bot. And the notion was that patients would visit with their peer recovery coach about once a week, but in between those in-person visits, if they needed support, say health coaching, they could access the bot. So the previous bot was accessed through SMS. This was accessed through a app on their smartphone called a Telegram was the name of the app. And there's a screenshot of it here to the right. And as you can see, it's got a little bit nicer user interface than SMS, not quite as accessible. But we actually found that pretty much everybody had a smartphone, so it really wasn't a barrier. And so this is the notion of a rule-based chatbot. The next step up from there, which is kind of what everybody talks about nowadays, are large language model-based bots. And we often use that term AI interchangeably, although they're not quite the same thing. An LLM is a type of AI, and AI is really an umbrella term, but we tend to use those synonymously. So with an LLM bot, it shares some elements with a natural language processing bot in the sense that it's still looking for some key words, but now instead of looking for single words, it can parse whole sentences and try to get a deeper understanding. Of course, it doesn't really think and understand. That's why I have it in quotations, but the algorithm is trying to better direct the user, not just based on a key word, but based on whole sentences. And of course, it's much more conversational. So referring back to the same study where we developed a bot for people in treatment for substance use disorder, at some point in the study, as the technology came available, this was, the development, I think, started around 2019, 2020. It was originally rule-based, and then as the study progressed, I think it was around 2022 when ChatGPT came out and APIs to access these different LLMs, we pivoted and this bot became a LLM-based bot instead of just being rule-based. So again, these three types of bot, I started talking about menu-based, then rule-based, and then LLM-based as the third kind of bot. And really, the basic intention, though, is that a user accesses this algorithm, this virtual agent, either on their phone or through a website, are the two common modalities, and they interact with it, sometimes having a conversation. And so that's the general notion of a chatbot. I'll pause there for a moment. Any questions or anything before I move to the next section? No, seem good. Okay. So now that I've talked about these three case studies, I'm going to get a little bit more into the nitty-gritty now and talk about what are some of the chatbot design issues. And with chatbots, it's really easy to just dive into the tech piece and focus on the tech and think about, what platform are we going to use for development. But, the starting point, just like with any good study design, is you really need to understand your population. You need to understand the clinicians, other support staff who are going to work with your intended population. And so you really need to get out of the building and engage all stakeholders or knowledge users, as we commonly refer to them. So if we think about in HIV clinical settings, you really need to understand how is this bot going to fit into existing clinical workflows? Because as we've found, if the bots don't, they're dead out of the gate. There's no point to even develop them. Clinicians are busy as it is, and the last thing they want is something to break up the workflow and to make their life more difficult. So it's really important to talk to everybody from on the clinical side to the patient side. And of course, we need to understand on the patient side, what is their journey through the clinical setting or community-based setting, from point A to B. At what point is the bot best going to meet their needs? Because just like the clinicians, if the bot doesn't meet their needs or it doesn't really fit into their patient care they would normally receive, they're probably not going to use it. And again, there's no point in developing it. So as AI technology becomes more and more prevalent and there's more and more we can do with it, we still need to ask the basic questions. First of all, is it even feasible? Does it require a platform that the clinicians don't have access to, the patients don't have access to? And how much of it is really needed? If a rule-based bot or even a NLP or that uses NLP algorithms, even though that's AI to some degree, but maybe we don't need to have a full large language model enabled bot. So more complexity is not always better, and we need to figure out the right balance. And one of the ways that helps us to do that, and there's different words we throw around, but it really implementation science using good human-centered design principles where we start by engaging stakeholders and asking them what are their needs. And then if we figured out, okay, the bot is going to be useful, we should develop it. Even then, it needs to be a very iterative process where we engage the stakeholders throughout development. And so on this diagram, I just show 3 cycles. You could easily do more than that. But you're going to have some initial plan for development. You're going to design an initial bot, you're going to build it, and then you're going to test it out. And it's probably not going to be very good on the first run. And so then you go back, you review, and you design again, you rebuild, test, and you repeat. And you keep going until you get what we'd say is a beta version that you're probably going to release to a small group of patients and have them try it out and see how it goes. And then if it performs well, you can release it into the wild, so to speak. Or maybe there's some bugs where you still need to go back to the drawing board. But we really want to be careful in using an iterative design to really meet the needs of our patients, clients as best as possible. And just to give you an example of a formative work example here where we wanted to develop a bot to support study participants in HIV prevention and care studies. And so we actually sat down with different groups of knowledge users or stakeholders. We sat down with research staff themselves, the health coaches, even the interviewers. And we sat down with community advisory board members and we sat down with study participants and triangulated what they were telling us to figure out what are the features of the bot that they would want to see, what are the make or break deals with the bot. For example, the researchers told us that one of the big needs they had was something to help them with scheduling with participants, but they didn't want the bot to reach into their schedules. They still wanted control of that. So there were some of those details that we were pretty careful with in thinking about the design, and this was an immensely helpful process. So some of the functionality that came out of that study and other studies we've done with focus groups is thinking about what are the basic functions a bot should fulfill in an HIV study, but more generally in healthcare settings. If we have a patient-facing bot, what are the kinds of things they're going to want to use it for? And one of the basic things is providing information and service referral. So for example, the rule-based bot that was for patients in treatment for substance use disorder, one of the things they wanted to see was service referral. And so we had it set up so it provided referral to services locally in the Boston area. So of course, one of the tricky things is you have to constantly update the knowledge base for the bot, because if the services they're being referred to are out of date, as a lot of these services change constantly, you really have to keep on top of that. So make sure you're offering something that you can really manage. But providing information, service referral, that's one of the basic things we found. Also scheduling medical visits. That's something that can be helpful both on the provider side and to patients. And health coaching. So getting back to the substance use bot again, in between visits where patients visited their peer recovery coaches once a week, let's say it's the middle of the week, it's late at night, and they're getting a strong urge, there's nobody they can call, they can start texting with this bot and asking it questions, how do I deal with my cravings? And so there was a lot of prompting, a lot of engineering that went into the bot to basically give it some health coaching techniques. For example, urge surfing. So the bot could walk people through techniques on how to deal with some of those, using some of those methods, cognitive behavioral and other types of methods. And another fourth type of functionality, which I'm going to cover less today, but it's worth mentioning. Instead of having a bot so the patient interacts with the clinic, or it really acts as an extension of the clinic, a bot can also help a patient to practice conversations. And this is a really nice study here I'm listed, and there's certainly others out there, where the idea is that the bot can help a patient practice difficult conversations with their partner. It could be, for example, supporting HIV status disclosure to their partner, or even talking about, using PrEP or other important conversations. And the idea here is that you can attach a face to the bot, and we refer to these as embodied conversational agents, or you can think of them as avatars if you're playing a virtual reality-based game. And you can attach a face that moves with the bot, but under the hood, it's still a chatbot that's driving the conversation flow. And this can certainly be really useful for patients. And that's a whole other line of research I won't get into today, but I'm also working on some projects in that area. But really the top three, providing information, scheduling medical visits, and health coaching, that's what we've found in our work are some of the most common types of functions that patients really want to see in a bot. Let's pause there briefly, see if there's any questions or anything else. Okay, sounds good. And of course, thinking about how are your clients going to access the bot? That's really important. So I gave examples where in the first bot, the menu-based bot, that was through SMS or text message, and that worked pretty well. We moved to the patients in treatment for substance use disorder, and we did focus groups with them. They all had smartphones. So they said, instead of interacting through SMS, we want an interface that looks a little bit nicer. And so we actually moved to a mobile app. But that is a decision you have to make. It worked in that setting with the patients because they're already connected to a clinic. So asking them to download a mobile app on their phone is a little bit more feasible. If you have a bot that's even more public facing, it might be harder to ask people to download an app and log in. So that's a trade-off there you have to really think about on the design side. Are the aesthetics of an app versus accessibility, if text messaging is easier. And of course, websites, that's probably what we're all familiar with. Whenever you go to a website now, there's a little dialog box that pops up with a person's face, and we all know it's not really a person, it's a bot. But that's another example of a way that bots can be accessed. Now, all the work we've done is the user decides when they want to interact with the bot. The chatbot or interactions are driven by the user. There's some other nice work out there by other investigators. I want to point out, though, that it could be that the bot itself is triggered by the user's environment. This is an example from a paper from smoking cessation, where the user's prior entered data actually kind of decides when the bot is triggered. And so this gets into this realm of just-in-time adaptive interventions, where there can be different triggers for the bot. It could be geolocation, if you're in a certain area. It could be based on user responses. But it's just something to think about as you're designing bots. And another question that comes up as we're designing these bots, okay, so how do we modify how the chatbot responds to the users? We can think of this as the bot's behavior. Of course, not a human, but we still use that word behavior. And the two easiest ways to change the bot's behavior, one of them is what we refer to as temperature. And oftentimes that's a simple setting. It's something that can be programmed. And the temperature goes from 0 to 1, with 0 being the least random and closer to 1. You can think about, as you heat up something on a stove, the molecules are moving faster and faster. There's more randomness. Why would we want to alter this? Well, as you get closer to 1, it does add more unpredictability into the response, but it also makes it more conversational. Because you think about it, if I have an ongoing relationship with you, I'm not always going to speak exactly the same. I'm not going to use exactly the same words, the exact same sentence structure. So if a bot is acting with the user over a period of time, we might want to turn the temperature up a little bit more just to make it seem more conversational, almost human-like. But that's something you'll have to decide on where in that spectrum between 0 and 1 you want to set that. Another thing that's pretty easy to implement is the system prompt. And as opposed to, when you go into, say, ChatGPT and you enter your own prompt, well, there is a system prompt in the background that you don't see that's already told the model, this is how I want you to behave. You can't talk about inappropriate subjects. But, you could have it as simple as, I only want the bot if, say, it's for people in treatment for substance use disorder. The system prompt could set the bot so it stays on that topic area and doesn't veer off too much. As we move down the spectrum of other ways to control how the chatbot responds to users, I've listed some other ways here. Retrieval augmented generation, or RAG. That's a term that people throw around. And it's simply the notion that instead of having to enter a prompt each time, if you have a prompt or other documents or information, you can actually attach them to the model itself so that every time the model is going to interact with the user, it doesn't just look in its own knowledge user base. It also checks this information that has been attached, or we say vectorized as a separate database, is attached to the model. So it also checks that. So for example, it could be that there is some new PrEP treatment out or some other HIV medication. The bot doesn't have access to that information on its own, and you want to attach that information. You could do that using RAG. Now, you could ask me, what's the difference between just prompting? Well, with RAG, it's really more embedded in the model for easier access, especially if there is a lot of data that you want the model to have access to. Another technique, a little bit harder to do, is you can fine tune the entire model. So instead of using RAG to attach, say, a few documents, you could readjust the entire model. And the way you do that is let's say you get more training data. You have data that's trained with people living with HIV, for example, and their responses, and you want the model to be more adapted to that population, you could retrain the entire model. And that's certainly something people do. Another technique, those first two, RAG and fine tuning, really have to do with training. You can think about it on the front end. Reinforcement learning through human feedback. In the early days of developing these models through OpenAI and these other companies, what they found is that even if you do RAG, you do fine tuning, if you actually give the models different sets of responses and you show the model and you say, okay, here's two ways you could possibly respond to the user. And let's say the user asks, what is PrEP? And one response could be very thorough, but very long-winded. And another response might be a little bit shorter and just get to the punchline about the key details of PrEP. And you could take both of those responses and you could show them to a group of users and say, I want you to rate both responses. Which one do you like better? And that information is then fed back into the model. So it's after the fact, post hoc, if you think about a statistical analysis in a way. And so that's fed back into the model and it changes how the model responds. Now, we did a bit of a simplified version of that, even in the model, the chatbot we developed for people in treatment for substance use disorder, where we showed them two different types of responses that the model would output, and we'd say, which one do you prefer? And then we use that to change how the model responds. And of course, the last way too is that you can really personalize how the bot is going to respond at the individual level. So all of the first techniques that I showed you really have to changing at a macro level or population level. How is the bot going to respond to everybody? Versus the last one is you can tweak how the bot actually responds based on the user's immediate responses. And this is tied into this notion of just-in-time adaptive interventions, and you can read a bit more about that in that article I have shown on the screen. Just pause there for a moment. Any questions there?
Looks like there's a question in the chat, Scott, from Ivy.
Okay, yes. My understanding is that you can only fine-tune open source models, not OpenAI, but those models might be trained on less data. Okay, yes, that is a great question. Yes, you're correct. Usually with these private enterprise models that are locked, you can't fine tune them, but you can use RAG. You can use the reinforcement learning through human feedback, which is what we did. I've had some experiences starting to play around with open weight models or the local ones, and I'm going to talk about how you can access them a little bit. But you're correct. With the local models and open weight ones, they are easier to fine tune because what happens with these, again, there's different terms, but the open AI or the enterprise level models, they're not going to give you access to the weights for the entire model. So usually what they'll do now is they'll give you access to some of the weights that you can fine tune, but they're not going to give you access to the weights for the entire model. So I've worked with some engineers who have done some fine tuning on parts of these enterprise models, and they've had some success, even getting the model to respond that way. But you are absolutely correct. The companies don't give you access to the full model. Great question. So let's talk a little bit about the architecture of the model. And, this workshop, my intention is not to turn this into a coding workshop, but I think just understanding how the model functions is helpful to understand its capabilities. And when people throw these terms around, you just kind of understand a little bit more like, what are they talking about? And so this might seem like a busy slide, but I'm going to break it down and walk you through it. So if we start on the left-hand side where it has user browser, you can just think about this. This is the interface. So this example is a website, but it could be a mobile phone, and this is what the user sees. The bot saying, hello, how can I help you today? And that's what the user sees. This is part of the front end. And so when the user types something in, they send the message that is fed into what we call the front end. And that's got HTML code. It might be a mix of JavaScript, JS, or other coding formats. And basically that code usually sits on the website or in the mobile app. And whatever the user says, it grabs it and then it pushes it to the back end. And the back end is what we say that's on the server side. And that's what's going to interact with the large language model. And the way the back end does that is you can think about it as a handshake. That's the way I think about an API or application programming interface request is the server is reaching its hand out and it's basically saying, will you interact with me to the LLM? And the LLM has to return the handshake. Otherwise, there's no interaction. And we want this API because if we don't have it, anybody can access the LLM. And the reason we don't want that for a number of reasons, for security, but the other one is to think about every time you interact with one of these LLMs, an enterprise level LLM, that's requiring a certain number of tokens or words, and there's a cost to that. You're getting charged. So you want to be able to manage your costs. It's right. It's just like your bank account. You have a password because you don't want to give anybody access to empty out your bank account. Well, that's why you need an API and you need to guard that API because that is your gateway to the model. And the companies aren't going to care how many tokens you run up. So it's really on you to protect the API to control your cost for the model. So the server is going to do this handshake. It's going to reach out through the API. It's going to connect to the model. And the model, the API, is going to then kind of say, okay, the key matches. It's like putting your key in a doorway. And then once you're inside the house, then whatever model you have designated, that model is going to take the user's response, and then the arrows that are all going to the right, everything is going to go back towards the left, and ultimately the user is going to see a response on their display. So this is even maybe an oversimplification, but I kind of wanted you to see the basic flow of what are the main chunks you really have to think about in the architecture. But of course, as designers, even if you're not a programmer, we often think of the front end. What is that going to look like? Is it going to be a mobile app? Is it going to be a website? The aesthetics of it. And then we need to think about the back end. There's going to be some programming involved, and we're going to think about what model are we going to use. Now, if we use a model on our machine, and we don't use one of these enterprise models, but we use a local model or open weight on our own machine, this flow is still basically the same. It's just instead of an API reaching out through the web to say OpenAI or another provider, it's going to reach into your machine. But you still want a layer of security to make sure anybody can't just reach into your machine and access the large language model. So the flow remains the same. And so let's talk about that a little bit for a moment in considering local versus enterprise and what are the benefits. Now, there's different terms people throw around. I mentioned local LLMs, thinking a model that sits literally on your machine versus being in the cloud. These are often referred to as open weight models because you usually have access to the model weights. They're not locked, and so you can tweak those if you want. And so thinking of the benefits for a local LLM, I mean, one of them is privacy and security. Because the model is sitting on your machine, now if you have people living with HIV or from other populations where they're probably concerned about who has their data, now you can make sure that's locked down. It's sitting on your machine. Of course, you have to guard your machine. You have to respect the patient privacy, but you have more control over that. Another benefit of thinking about why would we want a local LLM? Well, we can predict the cost. If you use an enterprise model, there's token usage. And if the model's running long enough, you can get an idea of cost, but that can be hard to estimate in the beginning. There's another thing too, if you have the model on a local machine, you can control the latency sometimes a little bit better, although that's not always the case, but sometimes you can. And as one person asked already, you have greater control, fine-tuning, system updates. So with these enterprise models, every so often they'll deprecate one of the models, or they'll put it out of order as they move to a new model. And we actually had that happen during their study with substance use disorders. We were using an OpenAI model, and I think that was during their transition from GPT-4 to 5, and they deprecated 4, and all of a sudden we're going like, oh, wait a minute, how does this impact our users? And so we had to do a lot of testing. If you have a local model, you're controlling the model. You don't have to worry about that. So with all those benefits, why would you go with one of these, frontier? That's a term often referring to the latest model that's out there. People also use the term enterprise, although any business can develop an LLM, and that's technically an enterprise. So I'll use those interchangeably, but basically, these are the models provided by the big three, Anthropic, Google, or OpenAI. Well, why would you use them if local LLMs have all these benefits? I mean, one thing is reduced hardware costs. If you're going to operate an LLM model on your local machine, and especially if you have hundreds, thousands of users, you better make sure that you have backup servers. If a lot of people access the model at the same time, you better make sure that the servers can handle it. Just like what happened to OpenAI when initially there was such demand, their servers started to melt. Now, maybe that's not going to happen in our world. That would be a good problem to have. But these are things you have to think about. You just have more probably firepower, capabilities if you go with an enterprise model, and the scalability. So these are really things to think about. It's not a clear cut and answer one way or the other. Let me just pause for a minute and see if there's any other questions. Another question. Are some open weight models better with certain languages? Absolutely. I'm not going to give you say cut and dry, one over the other, but I'll just say quickly, absolutely. It does make a difference. Some have been programmed better for other languages than others. So it certainly makes a difference. And it's kind of something you just have to do the research on. So I'm going to go through a simple demo. And again, I don't want to turn this workshop. It's not intended to be a coding workshop or to get into vibe coding. But I feel like going through this example of showing you how you can host an open weight or local model on your own machine and run it will hopefully demystify it a little bit. And so in this simple demo, I'm just going to show, let's say we want to run it on our web browser on our own computer, even though in the real world we'd want it out there. Let's say the code for the front and back ends are on our computer as well, which in an actual application, we'd probably have it on something like Vercel or some other web application. And we're not going to have any authentication that's needed because everything is local. And this is just to get you up and running to show you some stuff you can do. Two popular choices. When you're running local models, you're going to need some software to manage them. You can't really, I guess you could, but it would be a pretty headache to just try to download the model and figure out what to do with it. So you want some software. And two popular choices are Ollama, the other's LM Studio. I've talking to different people, developers sometimes like Ollama a little bit better. LM Studio is probably better for beginners, so that's what I'm going to demo. And I'm running this off of a Mac computer. You can do it off a PC just as easily. So that's what my icon looks like on the Mac for LM Studio. And when you open up the software, you're going to see you have a model, you have an option to search for different models. So as the question came in earlier, does it make a difference with models? Absolutely. In terms of language, what topic areas have they been trained on? For this example, I'm just going with Gemma, like the basic Gemma model. Why am I doing that? Because it doesn't take up a lot of memory. It runs pretty fast. And that's just for demonstration purposes, but you should definitely put some thought into if you're going to go with a local model. And then you can, once the model's loaded, you can view information about the model. I'm going to, in the interest of time, I see I'm getting close to the noon hour. I'm going to kind of zip through this a little bit faster. But you can change some of the parameter settings about the context length of the window, and this will impact how fast the model runs, things like that. I mentioned earlier the system prompt, also temperature. These are things settings you can change, and then you can chat with the model directly in the software. Now, why would you want to do this versus just launching it through a web browser? Well, the nice thing about testing it out through your software before you do anything else, you can see how it's going to interact with users before you do a lot of programming. You can tweak the temperature, other things. So I strongly advise do this first, and then if you like how the model's responding, then go to the next step. And what I did, and it's better to work with a programmer, but just to show you can do this, I used Claude Code to actually set up the code for me to make this thing work on my local machine. And so I just gave it some instructions. Now, there's going to be a bunch of files involved. I'm just going to kind of zip through quickly three main files that are the key files. One is called package.json. Another is called server.js, and then the last one is index.html. The package.json, you can really think about that like setting up the basic parameters and telling the computer like what model it's going to be running. It's kind of giving it some basic instructions. Server is on the back end. If you think back to that architecture file, the server does the handshake with the model itself. And then index is on the front end, and that's what the user is going to see, like the aesthetics, how pretty it looks. So just showing you code quickly, package.json, this sets up basic parameters. The index tells, it's kind of what the user sees. If any of you have programmed in HTML, you'll recognize this sets the colors and things like that. And then in this case, in order to run it, I just open up my terminal. I type in a basic commands. I have to go to that directory where these files are stored, and then I type in node server.js, the server file runs, and it tells me where to go on my local machine. I type in that HTTP, the local host, and then bingo, it shows up. And just to give an HIV example, I can ask the bot, what is PrEP? And it gives me an answer. So again, I zipped through this very quickly, not a coding workshop, but I just wanted to show you, hopefully, if you've been thinking about getting your feet wet, the first step is just download the software, either Olama or LM Studio. If you're a beginner, I would suggest LM Studio. And just start playing around with some of these local models. Tweak the temperature, put in your own system prompt, and just kind of see how they behave. So that's my plug for give local models a try. So in the last few minutes here, I want to talk about equity and ethics, and it's not the amount of time I'm devoting to this is no indication of the significance, because this is really the most important topic. We're working with vulnerable populations. We need to make sure their needs met, they are protected. And at the end of the day, technology is just a tool. So we want to give a lot of consideration to these topics. And, the first one I mentioned earlier, accessibility. We need to think about, how are people going to access this? Do they have a smartphone? Should we make it SMS, a web browser? Another issue we don't talk about nearly enough are environmental costs. We probably know data centers. They're not good for the environment, and usually they're put in places where the people benefit the least from AI and large language models, sadly enough. And I put this book up there. If you're into this field, it's one you should read. It kind of talks about the environmental costs a lot. And I think it's will really make you think about these things. Another one on the ethics side, protecting user data, user safety. This is a headline that just, I think from this July, where OpenAI was testing one of their models, and they wanted to see what it could do, and they thought they had it in a sandbox, and it escaped, so to speak, and actually was able to break into a real company server. So we have to think about these things and really protect our users. And as much as we think we're in control, we're not always. So what can we do? Well, one of the things I want to put out there, and this is an area that I'm really interested in. We didn't do this in these studies I mentioned, but these would be future directions. One of them is reducing the reliance on these enterprise or frontier large language models. And one of them is, you can certainly go with the local or open weight models, but another one is thinking, do we always need the most complex models? So earlier I talked about, menu, rule-based LLM models. Can we combine all three? Well, we can. And so this is really a nice study here talking about an STI education program where they used a multi-chatbot mobile application. And for some things, it was menu-based. Some things, when the users had basic questions, the LLM didn't kick in until later. So this is one way to reduce energy usage, a little bit better for the environment, but it also is a way to put guardrails on. Another growing area that's a little fancier way of doing this, instead of this, what I'm talking about here is combining the chatbots, is kind of the jerry-rigging it. It's a simpler approach. And there's this whole growing area of neural symbolic AI. We could have a whole presentation just on that. It's really fascinating. But I advise you to look into it more. But just in a nutshell, the idea is we still use LLMs, but they are constrained by rules. That's when we say symbolic AI, it's where AI started, and it's really more rule-based. And so the rules really layer the LLM and put guardrails on it. So what did we do in our study? Even though it was LLM-based, well, we still put a lot of guardrails on. We had stakeholder input at all levels of development. We made sure peer recovery coaches were involved. We worked with patients. We used safety monitoring protocols during deployment. And we used strategies to address these issues even in the chatbot itself. So what I'm showing here is that the input is when the user interacts with the chatbot, the first thing that happens is their conversation flows through a safety router. And what that means is that the safety router looks for any language in what the user is saying to indicate suicide, to indicate medical risk, because these are patients who could be experiencing relapse. And so it really classified the conversation into high, intermediate, or what they consider no risk. And if it's no risk, then it goes right into what's the user asking about. But if there are some risks, then it triages it into another workflow. So safety really was our prominent, design issue when we set this up. And I'll stop there. Thank you so much.
Wow, thank you so much, Scott. This is amazing.
Thank you.
Wow, I kind of wish you could keep talking about all these things because I'm like I'm like getting all these ideas.
Oh, good. I know. I just hopefully whet your appetite. I could keep talking too, but maybe another time. But,
Thank
but yeah,
you.
this is something I'm really excited about.
Thank you. So actually, well, we have 6 minutes, and if folks have questions, if you can please raise your hand or come off mute, and I'll actually ask the first question, Scott, is if I know we didn't have time for this, but can you just give us a little bit of a flavor for what's coming in the future? Because I'm sure you probably have a lot of exciting things in the horizon.
Yeah, definitely. And one of the areas is on the neurosymbolic side. And I guess it gives me an excuse to talk about that a little bit more. And what's interesting is when the AI field was developing in the direction of language and just AI in general, there were these two camps. So AI started out on the symbolic side being rule-based. So if you think about going back to, I think it was the 80s, when people made a big deal about, I forgot which AI-based program beat Kasparov in chess. That made headlines. It was a big deal. AI can beat a world chess champion. Well, that was all symbolic AI. And then as we got into the 2000s and compute increased, well, that kind of fell out of, the limelight and people started thinking deep learning. What I really am interested in, this is a growing area, is this notion of taking the best of both worlds where we really do need to think about rules with these bots to keep the guardrails on. Putting an LLM out there and not expecting it to misbehave is just not realistic. So I think layering it with the symbolic AI, it's going to be a growing area. And I think in HIV research, it's really important.
Thank you, John.
Yeah, thanks, Scott, for the talk. My question's more, I guess I kind of asked this of everybody that speaks on this topic, is sort of the computational and the coding expertise required, because I see that as a sort of a really big gap in terms of given the push and the investments, even at our institutions, about the use of AI. And I think in terms of, how in case of our division, we got 20 plus faculty. If we were all in and everybody was sort of figuring out ways to adapt it in various components, not necessarily chatbots, but all the ways you can think of using it, I
Yeah.
think there's a real workforce shortage in terms of identifying those folks who have the computational expertise who can help us who are maybe have less of that and bridge that gap in terms of building something together. Because I know that I've had the challenge of working with folks that are just so far into that technical arena that
Yes.
we have a miscommunication. We're covering such a big gap that it's hard to even articulate sort of what I would need, what are the concerns. So how do you think about
Yeah.
who needs to be at the table and the different disciplines around so that we can build something sort of efficiently without sort of feeling like we're talking two different languages?
Yeah, that's a really good question. And I think one of the ways is that everybody needs to be talking together from the get-go. So I think as an example, the bot I talked about, developing it for patients with substance use disorder, from the very start, we had the programmers at the table with the peer recovery coaches and the addiction medicine specialists. Because I think the problem is a lot of times, we'll kind of see like the programmers is like, oh, that group of people over there, and we draft what we think the bot should do, and then we'll give an assignment to the programmers, and maybe they don't feel comfortable asking us, or there's not a lot of communication. And then on their end, they're just going like, well, this isn't realistic. We can't do this, or they don't know the questions to ask. So I think making sure everybody is, I mean, obviously, we're all busy people, and you can't have people there at all the meetings, but I think as much as possible, make sure at every time you're going to design something, there is a programmer, someone with that expertise in the room that they can report back to the main group and say like, okay, this is what we're being asked to do. And then vice versa. They can also inform the rest of us who don't have all that knowledge to get us up to speed. But I think you're right on the gap. I mean, one of the things that I try to encourage faculty at UCLA to do is to start using the tools where you don't have to program just to get your feet wet. So for example, and I'm not here to push any particular software package. So if I say names, it's not, I don't have, not vested, but like, for example, I use Claude Cowork. Now you could use OpenAI and they have Codex and, there's Gemini, there's a version, but basically some kind of AI program that can do things for you where you don't have to code it all, but you kind of understand. So the reason why would I use Claude Cowork versus just the chat interface? Well, because I can get it to do things that I don't have all the human support I had before with budget cuts. So if there's something a human assistant would do, now I ask myself the question, well, can Claude Cowork do it? So for example, I'm going to submit a grant in September. It's not ethical for me to ask the AI to write the grant for me, but there's a lot of support documents that I would normally pass off to a human assistant. There's budget justifications, there's, MPI, sharing plan. There's all kinds of stuff like that that Claude Cowork can write for me. That can save me a lot of time. And just starting to use those tools and understand what's needed to interact with them and how they work. It doesn't take any coding, and you're going to make some mistakes, but there's nothing detrimental. Like if I give it a prompt that doesn't make sense, okay, so I'm going to get garbage out, and you just kind of get your feet wet trying things that are lower stakes and do that. So that's my recommendation. You just kind of got to get in and convince people to start using it. When they see the time savings, they'll want to use it.
Wow, thank you so much, Scott. We're at the top of the hour. If folks have other questions, if it's okay, maybe they can reach out to you directly.
Absolutely. Yeah, that's why I've got
Scott.
my email up here, and I'm happy to talk to anybody. Again, it's a topic I love. HIV is a field I have a passion for, so I'd love to talk to you more.
Wonderful. Thank you so much. I'll be sure to reach out. Thanks, everybody. Hope to see you next week. We have another presentation.